Dr. Naresh Trehan, Executive Director, Scott's Heart Institute and Research Center, has conducted over 1,300 critical cardiac operations, where there was 80% damaged heart functions.
Dr. Trehan quit his lucrative job in the United States and began his work in the country by equipping the institute with the latest standards of computerized cardiac care in the world, drawing the personal canvas of a surgeon who finds himself incomplete without computers in his medical profession.
Dr. Naresh Trehan's close interaction with computer began in US and continues with great gusto even today. But how important is the computer to Dr. Trehan?
I think in today's environment it's become a very essential and integral part of our working every day. So there is no question that I would say it's like I use a computer more than I use a pen now. You know, I was in the United States in mid-1970s, about I would say 75 or so, when we computerized our hospital there. And then we started with a very primitive form of what we call the hospital information service, which actually we were just taking, listing the patients on it and where they are, their locations and stuff like that. And gradually by the end of 70s, we had almost everything computerized. So over a 5-year period, we could do complete patient care on the computer.
Dr. Trehan finds several advantages in computers. In his medical profession, the computer helps him to make the right kind of decisions with regards to his patients after acquiring required information.
There are several advantages of a computer. One, of course, you can access information which is very important in your decision making. Now, supposing I want to look at a patient's history and his latest blood tests. By the time we track down the papers that may have come from different parts of the hospital, one, they may not have been even compiled into the chart, but we know from all our centers in the hospital that they've already been entered into the computer as and when the tests are done. So at the touch of a button, we can retrieve the entire background of a patient. You also know what is happening currently, and then it helps you to take the right decision.
Besides helping in taking decisions with regard to patients, computer helped Dr. Trehan in teaching and research work.
One for patient care, where we have, like I said, clinical decision making, record keeping. The second is a lot for teaching, where we have programs which we can run on the computer for different teaching programs, literature, all this other stuff. And third is research, very important for research, because we have data compilation of our entire patient base. So we take every patient who walks into the hospital is entered into the computer, is actually put in under different codes, so that we can retrieve the data. And in our 7 years of experience, I think it has helped us to produce more research for India in the field of cardiac diseases than maybe we would have not even been able to do 1/10 of it without the help of a computer.
For Dr. Trehan, the medical profession has become a part and parcel of his life, and as a result, he computers too. At the same time, the computer has also become a tool for him to spend playful time with his children.
My personal life outside of medicine is very limited, so it comes to accounting and maybe referencing some materials which I want to, and then playing games with my children. So I think it's a great contribution of a computer, that you can go home and have interactive playtime with your children in an intelligent form.
Dr. Trehan is very clear in his mind that computers are going to play a major role in every person's life.
I'm very clear in my mind that computers are going to be absolutely essential in the functioning of a human being if you're going to do any professional job or actually in your life. I don't think that, I know there is a resistance to, like we have this old saying about it's hard to teach an old dog new tricks, but I don't think that we should allow that to dictate to us, because at any age you can learn it. You don't have to be an expert. I think one of the biggest mistakes that is made is that it seems like a monster, and you think that you are going to master it all in one go. which is absolutely not necessary. All you need to know is how to enter a computer and how to look at a menu, how to, whatever is your interest, you start with that, and over a period of time you become very comfortable.
Love for the Nation brought back Padam Shri Dr. Trehan to his country, where he's researched and developed minimal invasive heart surgery.
This has enabled patients suffering from heart diseases to save lots of dollars because now they don't have to go abroad for their heart treatment.
Well, that brings us to the end of this episode. See you next week, same day, same time, same channel. Till then, goodbye.